Good morning and afternoon to everyone. Thanks for joining us today. We have a very interesting chat planned for you all surrounding clinical information connectivity and how this can support your physician alignment efforts. My name is Sarah and I'm from Relay Health. I'll be facilitating our talk today, and we have three really special guest speakers that I'd like to quickly introduce before we get started. So firstly, we have Steve Lawson. He's the Vice President of Clinical Solutions at Relay Health. He has been with Relay Health for over 9 years and is based in our Emeryville office. Steve leads our teams working with our health system customers. Steve works with clients to understand how to use clinical information connectivity technology to enable the organization's priorities and goals. Thanks for being here, Steve. Secondly, we have Ben Clark. Ben is the Vice President and Chief Information Officer at Centra Health in Virginia. Ben has worked in the management of healthcare technology for more than 30 years. During his 12 years at Centra, he has led a clinical transformation team of physicians, nurses, and ancillary staff through the implementation of advanced clinical applications. Under his leadership, Centra has achieved healthcare's most wired status for many years. Centra has been awarded Virginia State grants for collaboration and intra-hospital data sharing. In addition to Ben, we have Wendy Cassidy. Wendy Cassidy is the Manager of HIE and Integration at Centra. Wendy was a staff nurse at Centra for 8 years before she transitioned into the IT space, providing a bridge between IT and clinical practices, where she has been in this position for the last 17 years. In 2012, she became the lead for Centra's HIE efforts. Thanks for all of our great speakers that have joined us today. We're excited to have this chat lined up. So just to give people a sense of what we have planned for the conversation today, Steve will kick us off providing a high-level look at 3 trends that are shaping the ambulatory community as related to IT. From there, Ben Clark and Wendy Cassidy, both from Centra, will dive into those 3 trends and really how they're impacting their organization, what they've done to address their organization's challenges, and lastly, what the result has been from those initiatives. Finally, we'll wrap up with a Q&A section. Please keep in mind that your lines have been muted, so if you have a question throughout the webinar or during the QA process, please type that into the QA chat box provided, or the other chat box will work as well. We also have several points where we'd like to enlist your participation in a poll to help guide the conversation. So we look forward to having you participate there. I will open a poll when the time comes. That box will appear on your screen, and you simply choose the answer that most reflects your situation. So without further ado, I'll turn it over to Steve Lawson, Vice President of Clinical Solutions here at Relay.
Great. Thanks, Sarah. And thanks, everyone, for participating today. And I appreciate the opportunity to speak with you. And I also want to thank Ben and Wendy for taking the time to participate as well. So as Sarah said, I'm going to take you through 3 high-level trends that are impacting our customers, and I think some of you on the phone, as it relates to clinical connectivity and really driving your physician community to work with you in a more effective way. So the first, which is no surprise to, I'm sure, anyone on the phone, we'll make sure we have our content, great, is the actual EHR adoption. So as many of you know, physicians are adopting EHR at a very fast pace, and as you can see, it's quadrupled since 2001. So when you have technology adoption that is going at this pace, there's going to be some level of confusion. There's going to be a lot of change management that's going on within organizations. And it's important to recognize what that means to you and the business in which you're looking to drive. So if you look at the details of that trend, You may or may not believe we're at 78% adoption. My skepticism is that we're somewhere in between somewhere a little below that number. A lot of people have EHRs that they've quote-unquote adopted, but they really are in some level of that adoption curve, even though they may have purchased or are adopting it. Now, some of the trends around an EHR adoption is around meaningful use. Of course, that is a main driver for many of the clinicians in ambulatory communities. But also there's a sense of consumer demand in which many consumers are starting to reflect that they are demanding and wanting their clinicians to have this sort of technology and are starting to believe that that really inspires better care and are seeking clinicians and health systems that have adopted these sorts of technologies. So along with the fact that they're adopting EHR is a compounding issue, which is EHR fragmentation. And so just because clinicians are adopting the EHRs that are required for meaningful use or their patients want them to, doesn't mean they're all the same. So many of you will see that you have a wide variety of EHRs in your communities. And even within a certain brand of EHR, you have differences between the ones that are being adopted. Maybe it's the same brand, but you have two totally different instances, which creates confusion. So if you think about that complexity, there are over 700 unique EHRs in the marketplace. So that creates a lot of pressure on our health systems to be sure they understand the differences between these EHRs and what it means to their business and how they drive those clinicians to ensure that they still do business with the health system. So within the Relay Health base, so many of our customers are health systems that have a variety of EHRs in their community. We see anywhere between 5 and 50 different EHRs within the networks in which our customers are trying to connect to. And that presents a lot of complexity, things like the workflows for the clinicians, the experience for your patients, the catalogs and how they map to your systems within your health systems, all creating a lot of complexity and a lot of variability, and ultimately ways in which your staff and your community needs to deal with that become critically important. The third trend, on top of the complexity that we just brought forth with the EHRs, is around competitive pressure. So many of our health system customers are looking to drive business toward whatever programs they have around reference lab is one main driver that we see for health systems wanting to drive. But there's competitive pressure that some of your competitors in the market are looking to create an edge for themselves so that they can continue to either maintain or expand their business lines that they're investing in. So one of those business lines is around reference labs. So representing 50% of the market share is national reference labs in a $24.1 billion industry. Those national reference labs are out in the market with technology offerings that they really want to take advantage of those first two trends, which is the EHR adoption to make sure that they're in the right time at the right place to capture those orders and to make sure that the clinicians, as they adopt technology, can continue to do business with them. So the health systems need to do the same, which brings us to, I think, a very important discussion today. And if you think about the competitive landscape, a survey from 2011, which if you extrapolate out would continue, is that you notice that blue box, the blue line in the bottom is the hospital reference labs. They're losing share or had been, and it's important to note that if health systems are going to compete, they need to have contemporary offerings in which they can try to capture that share back for their important initiatives.
Great, so it's actually time for our first poll. It is around which trends create challenges for your organization. I'm going to open that poll, and if you could select A, B, or C on the first question there. I'll give people a few minutes. So again, please select the answer that most reflects what your challenges are as related to these trends. Okay, great. So it looks like, I'm going to close that poll. It looks like we had a majority of folks, about 27%, that listed EHR fragmentation as one of their major challenges alongside of competitive pressure.
So Sarah, an observation from that is that that's not a surprise in terms of what we're hearing from our customers, and that the EHR fragmentation and the variability of that EHR community creates a lot of challenges for our customers. And I know the folks at Centra are faced with that exact challenge.
Great. Okay. So at this point, we'll have introduce Ben Clark again, and he will continue the conversation specific to Centra.
Well, thank you, Sarah. We're happy to be here, Wendy and I, and look forward to telling you a little bit about our story and what we're doing. We're sitting here under an unusual blanket of snow in the springtime, but that hasn't affected our HIE work at all. So before we get into the details of our offering, I want to tell you a little bit about Centra Health. Centra is a regional, nonprofit, non-aligned, integrated healthcare system, and we're located truly in central Virginia. We're about 30 miles from Appomattox, where our nation reunited, and we kind of take the reunited part very seriously as we look at our mission, which is excellent care every time, and to provide health care to the community in our region. We support a little over 600,000 people with pretty comprehensive medical care availability to this area. We have 4 hospitals and a little over 650 beds. Centra also owns 4 nursing homes, a variety of physician practices, joint enterprises such as imaging centers and outpatient surgery centers. We're cradle to nursing home care and everything in between. Our physician community today is made up of 50% employed and 50% non-employed physicians, and it has not been our tradition to employ a lot of physicians until just recently. And this has, of course, led to one of our many challenges that we face. So this one challenge is that when we looked out at the EHR landscape, at one time we had 9 physician practices with 8 different EMRs, and this was just a few years ago. And this was both on the employed and non-employed side. And as you probably know, this kind of fragmentation with many different systems is a real problem in trying to get data connected, and that certainly has been the case in Lynchburg and Central Virginia. So if we looked at our employed community, as I mentioned, 50% of those physicians today in this area are employed, but there was even fragmentation there, because as Centra employed physicians, we collected a variety of EHRs and trying to integrate those together. We had a number of Allscripts sites that were, as Steve had said earlier, were different instances. And we have worked pretty hard to bring the sense that the physicians do not have to worry about the EHR, that we'll use our HIE to connect it together. And then in the non-employed community, that still continues to be the Wild West free-for-all. I'm thinking about this discussion today. We still have at least 8 different EHRs deployed, and this fragmentation just makes the connectivity very complex. In fact, 6 years ago, we only employed 1/3 of the physicians. Today, we're employing 50%, and that just continues to grow as physicians look to align with Centra because of the connectivity and because of the things we've been able to do with Relay Health. So
then we have another poll quickly. I'm going to open that for folks. So this poll is how many different EHRs make up your health system's technology ecosystem. Just interested to get a sense of the folks we have on the phone. So I'll give people a few seconds to answer that question. Again, it was how many different EHRs make up your ecosystem. Okay. So it looks like we have split between folks that have 1 to 10 and then 11 to 30. So somewhat similar makeup to what Centra's experience was. Okay. Back to you, Ben.
All right, thank you. So the next big challenge really has been facing this increasing competitive pressure in our community around our reference lab business. Centra originally, or a few years ago, really dominated this area. But the advent of these electronic health records certainly has forced us to look into an electronic connection, and that then has brought this competitive pressure on. We are seeing this increased pressure from the national reference labs because, in part, they come in and were able to at least connect up faster, cheaper, quicker. These were all things that were music to the physician's ears. You know, and they were also able to market directly to our physician community in a way that we weren't able to. We weren't prepared. We didn't have that skill set. And with a 90% market share at the time, we had nowhere to go but down if we didn't do something. So as we heard Steve say previously, we would rather not have these reference labs taking market share away, because they certainly weren't going to grow it new in an area with a 90% market share. So part of the value proposition with the national labs was that they were competing with us in something that we weren't competing in, solicited and unsolicited orders. Now, we had been delivering orders with unsolicited results for several years, but we were not able to deliver the solicited orders and results. And they were offering this to the physicians at no cost, and at the time, when we first started, we were still dealing with some stark questions, and our legal team was getting engaged, and it became increasingly difficult to compete and to offer the same kind of technology that these reference labs were given straight to the physicians. So ultimately, we began to experience some real market pressure as some of our large physician practices were announcing they were moving to a reference lab, or were really leveraging us harder and harder to deliver the same kind of work and reference. So all these challenges combined to lead us to look for a solution that connect the desperate EHR landscape, optimize the workflow both for physician and our lab processing, which included an easy way to get the bills out, and perhaps more important, provide a competitive offering that made it easy for our physician community to stay with us and work with us. And of course, our theme was really just to make it easier for physicians, make it easier for our labs, and ultimately make it better for the patients. And we've had a long history of working with physicians, so this effort on the reference labs to come in really hurt initially. So we started developing a phased approach and trying to wrap our heads around the problem, move forward in a solution mode that would make this come together easily, and the physicians want to participate. We took time to step back and kind of develop the vision, our HIE, our connected vision for this organization, and what was our strategy going to be around clinical information connectivity, and where were we trying to go even beyond solving this immediate issue of orders and results. So what you see here is a pretty simplistic but pretty well thought out, we think, way of framing our problem and working towards a result. And Relay Health gave us a lot of support and effort in coming up with this. It's important to point out that that trajectory, that line that goes up kind of with levels of engagement and levels of clinical integration, they build on each other, and there's a milestone that must be met each at a time. You just kind of can't do this all at once. Our goal with this was to provide our patients with better care, position ourselves to lead the way in our community on connected information, and we wanted our technology strategy to be an enabler. We are always, in my view, an enabler. Technology must not get in the way of achieving any kind of clinical transformation or care improvement. Technology is an enabler. So the first step was to go about getting physician alignment, and this is the core. This is the core issue to get started. How do you make it easier for physicians to connect? And once they are connected, how do you make it easy for them to share information that they need to treat patients? We are building out that clinical data repository with this section so that once the repository is there, the physicians are truly sharing information. Once you get past the physician engagement and the doctors are happy, if that's truly ever possible, but they're satisfied, they're getting something of value for their work, it's finding utility in that technology, and that's how you move into the patient engagement piece. And this was manifested in our patient portal, and that's something we are just rolling out now. And getting patients to use that portal, you need the physician support, because if the physician is not engaging the patient in the adoption of the portal, it just will not be used. So the physicians are a key influencer there, which is why the alignment with physicians first is so important. And you also need something out there that the patient wants to look at. Otherwise, they'll just go in one time and fall out. And we have seen that in some of our non-employed physician practices where they've rolled out these patient portals, but they can't get any traction. So once you've established that you've got a physician alignment and you've got some patient engagement, that's where the real juice of everything starts coming together in an enterprise health information exchange. And how we can really make data a longitudinal patient record viewable both on the provider side as well as the patient side and available at the point of care. And this has all kinds of implications when it comes to facilitating coordination and driving quality and efficiency. So that's the vision. That's what we saw. And this transition that we had from just a connected community to an HIE-based community. And we need to build on these capabilities and continue to grow that for an effective physician alignment strategy. So with that, I really want to turn this over to Wendy Cassidy, who is the brains and the driver and the person who should get credit for what we've done so far. She's been the key leader in driving the success that we've seen in our community and the work around the community and implementing this closed-loop orders and results offering. She's also really been at the heart of how we get this done. And so with that, Wendy, I'll pass it to you.
Thanks, Ben. So one of the key initiatives that we wanted to look at for Centra was preparing for the payment structure changes that were out on the landscape. So in doing this, we were focusing on implementing strategies that would prepare us for accountable care and population health management. We partnered with McKesson on an ACO demonstration project, and a key component of that project was the implementation of the Relay Health solutions. So some of the Relay Health solutions that we have implemented and looked at is first we had to set up some infrastructure, so we needed an ADT feed to send our population into. We set up result feeds from our ancillary systems so that we get all the labs, RADs, transcriptions, everything that goes to our inpatient systems also goes to Relay Health. We set up and implemented solicited orders and results to our EHR ambulatory systems. We've also been working on the CCD or CDA exchanges. We have connected our acute hospital CDAs up to Relay Health. We're kicking off a project in the next week to work on bringing in the ambulatory CDAs and doing bidirectional exchange with those ambulatory practices. We've set up and worked with a third party in Relay to set up secure messages to go back and forth to the practices. We've done workflow integration between our Allscripts EHR system and Relay Health to make the workflow much easier for the physicians in those practices. As Ben said, we're working on our PHR rollout to our patients now. We've also expanded Relay Health to do some charge capture and routing for our provider-based billing. We've done some work with one of our reference labs in the area. We have some insurance companies that require labs to be done by certain providers, so we have a good relationship with that reference lab, so we're bringing those orders out of our EHR systems and sending them to that reference lab and getting those results right back into our EHR. And we've also taken this functionality to our in-house labs done in our office practices. So that was always a big gap that we had between the hospital and the office, is things that were done in the office we never had access to. So we're in the process of rolling those in-house lab results back into Relay Health so they can be distributed out to the community. Creating a governance committee. We set up, we have several committees that help us work through and decide on how to move forward with this. We have an ambulatory informatics team that we work very closely with. As they bring up new practices, we have to be ready and on a timeline to roll and bring those practices up on the Relay solutions when that occurs. We also have a patient-centered medical home committee that we work with. They help us define who are our next practices that they're looking to certify for patient care medical homes, so we want to roll out the functionality that Relay has that will allow them to meet that certification. We have a medical practice steering group that we work with to help make sure that we're all on the same page and striving towards the same goals. We have a very strong project management team that helps keep us on track and keep us focused on what the tasks are, what the milestones are, and keeping us moving forward. And then we certainly work with our IT team. So understanding your workflows, it's important that you build support system around the workflows that exist in the systems you're expecting to connect. So we've been lucky. We have an ambulatory informatics team that works very closely with the Centra practices, and they go out and work with the community practices as well, helping support these orders and results initiatives. The team works very closely with both the Centra practices and the community practices to look at workflows and where we can help engage the practices during the processes to review and implement these solutions. So it's not just something that we do for our practices. We offer these services and support systems to our community practices as well, and that's been very helpful in making us successful. So the next piece is we want to talk about is engaging the EHR vendors. I think it's very important that you establish a single point of contact for the vendor. You don't want to be working with 3 or 4 different implementation specialists if you're rolling this out to 3 or 4 different practices that use the same system. So we've been very lucky. We've got a large footprint of Allscripts systems within our community, and so we have been able to utilize the same Allscripts resource for each practice that we bring up. The other thing that we found is that we need to engage these vendors very early. They have very tight timelines, and it's hard to get our projects on their timelines. So we look to try to engage them 3 to 4 months in advance. So identifying priorities, as far as rolling out the lab orders and results, we prioritized our sites primarily based on volume of tests that they performed and sent to our lab. And we engaged sites that were willing to be strategic partners with us and that we had a strong working relationship with. Our first site we brought up was obviously a Centra site, and there were many reasons for that. We had a test system for them so we could test the process and the code and the functionality. And we felt like our own site would be a little more tolerant of working through the nuances that you identify when you roll in new workflows and technology. But I will say our very second site was a very large non-Centra practice in our community that did not have a test system, and they were willing to work with us and put in the hours to work through workflow issues that they had within their practice to make that work. So it was very important to us that those first two sites be successful. We had to prove to the community that we could do it in our own central practices and that we could also do it throughout the community. So the value we've been able to illustrate, as Ben said, we have had result distribution through many different solutions for several years, but our providers have been pushing us hard to pursue full integration of solicited orders. So once we were able to demonstrate a proof of concept with our first two practices, selling to the other practices became very easy. It was important that we had strong success with the first two for both Centra and non-Centra. So gains for the practices are essentially the closed-loop functionality. So when the result comes back in, it actually completes the orders. Some of our EHR systems will, if the results are all normal, it'll just automatically file to the chart, and there's no review that needs to take place by the physician. Some of our EHRs still require the physicians to review all those orders. So we've also been able to position ourselves for our PHR rollout because now we've got data in the PHR that the patients are interested in getting. They want to get access to their results, and they want to be able to see that. So engaging practices through partnership, we decided early on that we wanted to set up partnerships with the practice, so we offered some of our IT services to those practices. We recognized early that a lot of these practices that we wanted to interface with did not have large IT staffs that could, support this type of rollout and the technology needed. Most of these smaller practices have contracted IT people that they call in to work with them as needed. So we utilize assistance and support from our ambulatory team and to help deploy these solutions. The other thing that was real important to us is we wanted to set up a practice, and we wanted to have a methodology in place that we could make this rollout as repeatable as possible. We knew we had to roll these out quickly. We were bringing practices up every 2 to 3 weeks, and we needed to be able to meet the needs of having those practices come up on solicited orders and results. So I'm going to explain the process just at a high level on what needs to happen to make all this work. So we get an order from the practice that's sent to Relay Health. Relay Health, once it gets that order, it generates an ADT registration to our billing system. The billing system then automatically registers the patient and sends back a registration to Relay Health. Once Relay Health gets that registration back with the full registration complete and the account number, it will then generate the order outbound that goes to our lab system. So once the lab gets it, they result that back, and that result goes back into Relay, and then from Relay it's distributed back to the EHR based on the providers and what practices they're in. So that is the process for every vendor that we bring up. We have to go through that process. Now, all of those steps are repeatable regardless of the vendor except for two, and that is the order coming out of the practice. There always is some coding and some tweaking that has to be done in that order for that order in order to get it into Relay in the acceptable format with the HL7. And then the second part of that process that always has to be adjusted and tweaked is the results back out to the EHR. So whenever we bring up a new practice, all the pieces in between, the ADTs going to the billing and the orders going to the lab and the results coming back into Relay, all of that is repeatable and doesn't have to be redone with each implementation. So when we bring up new ones, we only have to focus on the orders from the practice and then the results back to the EHR. We also have an activation checklist that we go through for each practice we bring up to make sure any of the one-off codes that we may need to put in are addressed and identified. So the demographic you're looking at now is this is where we were back in October of 2013. You can see our Centra affiliated and our non-affiliated sites that we had rolled out. So if we go to the next slide, in January of 2014, you can see where we were just able to quickly roll this out and get a lot of footprint throughout our region. So next we're going to talk about some of the efficiencies we have gained with the rollout of solicited orders. So from the perspective of lab operations, the new workflow has made some big impacts on increasing the efficiency of the laboratory process. When we first started this, our lab had 4 different processes for working specimens. So depending on what practice came up and what solution they came up on, the lab had 4 different processes when they received the specimens that they had to go through in order to be able to process those. We currently have them down to 3 processes, one of those being Relay Health. And we are now at 50% of all of our lab specimens that come into our lab are processed via the Relay Health solution. We also had sites looking at other lab vendors that could provide these solutions, but because we have been able to quickly roll out the Relay solution, we have been able to keep those practices with our outreach lab instead of them going to one of the national lab reference labs. We were able to streamline the workflows and increase efficiency of lab specimen receiving area to the extent that we have been able to accommodate a nearly 20% reduction in staffing with minimal consequences. Now, this solution, we didn't implement this solution and go in and say, okay, now we can get rid of 20% of the lab receiving staff. That was just a natural cut that occurred based on some streamlining that was done, but we were able to absorb that change in staffing patterns with little interruption. So, Ben, I will turn it back over to you.
All right, thank you, Wendy. So in conjunction with the great results we've seen from an efficiency perspective, we've also been able to experience some impact in terms of how Centra is positioned and competes in our community. First, this new capability really provides us with a competitive edge, something that we really needed to make a case for ourselves to the physician community. This is particularly true when the national reference labs came in pretty strong, made a lot of noise, really teased several practices into agreeing to actually move to them. And something that a CIO never likes to find out, we actually had our CEO putting his personal reputation on the line that we were going to get a solution available to these practices that were talking about leaving, and we were going to do it pretty quickly. So he put his mark on IT making this solution work, but it's not a comfortable position for the CIO to sit when that happens. But we were able to deliver in a way that had significant impact on our ability to hold on to these key accounts, and in fact we have. And we have maintained market share, and it definitely would have been lost had we not rolled this Relay Health solution out. So Wendy?
Okay, so making it easier. our goal was to make the ability to place orders and get results easy for the patients. So we wanted to bring efficiency to their workflow. So what we did is we went in and we didn't change their workflow on how they use their EHR. They were using their EHR to place orders, and they were, sometimes we're getting results, sometimes not. We didn't change how they were placing orders. We just enhanced that workflow, and that they place the order. Now the order, it gets generated out to Relay, and when the result comes in, it actually completes the task on their task list. So it's one step that they don't have to do. They just have to review the result if there are any abnormals on it. Physicians are satisfied. This is, kind of a hard one to talk about. Physicians aren't coming to us and saying, you did a great job, but they're not making any noise either. So we know when they're not satisfied, we know that they're having issues. So we really aren't getting any noise from the practices. So when we convert them, if they were already on a result feed and we convert them to orders and results, we're not getting noise from the practices. So what that tells us is that the office staff is functioning okay and working well with the system and able to manage everything that's going on, and the physicians are happy with what they're able to do, because if they weren't happy, we would certainly know. So our goal has been to make this transition for them as seamless as possible, and I think we've been successful at that. So because we've been successful and the word's gotten around, we've got a lot of buzz traveling around the community, word of mouth, that providers are really starting to come to us and ask, when am I going to get on the list? When am I going to get on the list? So we're really excited about that. Now we're starting to work with some of the one-off vendors that's presenting some challenges, getting their time, getting their commitment to work with us in the practice to make those work.
So this is Sarah again, everyone. We have one more poll before we have Ben wrap up around where they're going to go from here, from a strategic standpoint. So I'm going to open that poll for everyone. So the question is, which is more a priority for your organization? If you had to pick one, is it around establishing competitive edge, or do you think of it more from an operational efficiency standpoint? So again, I just opened that poll. Just choose the answer that best represents your organization's priority, whether that be around competitive edge or operational efficiency. So seeing things come in now. It actually looks, let's see, actually now it's changed. It was even between competitive advantage and operational efficiency, but it leans a little bit now more towards the priority being around a competitive edge and establishing that for their organization. So really interesting there. So Ben, have you wrap up talking a little bit about where Centra goes from here?
Thank you, Sarah. Yeah, so we would definitely say that this project has helped us maintain our competitive edge, maybe even establish it in several other areas. And if you kind of circle back to where we started all this discussion earlier today, you can see a lot of what we've accomplished has been around physician alignment. And physician alignment, it's not monolithic. It's not an employed-only strategy. We believe, certainly in our area, that in other communities around the nation, that there will always be employed and non-employed, and there simply must be a strategy to bring all of those into the fold. And our solution here with Relay Health has really helped make that happen. Of course, making it easier to order and receive lab results is important. That was part of the foundational work we've done, but our health system is more than just a reference lab business, and it's more than just aligning with physicians on certain things. We see this HIE as the foundation to build a lot of work between employed and non-employed physicians for services we provide, for opportunities that we may receive from the physician practices as well. Having a CBC available to the whole community means a reduction in costs across the spectrum, because we'll only do that one time, and any physician within the network will be able to see that. So that's kind of the foundation of where we're building from. Steve, I didn't know if you wanted to comment on the levels of engagement versus integration first or not.
Well, to echo what you're saying and enhance it a little bit, so if you think about the journey of Centra, so we talked a lot today about lab, and it's a very important yet tactical necessity for folks to compete with others coming into your market, and how you really address some of the dynamics of EHR. But what I think is important for some of the people that are participating in this to realize is that this is a journey for Centra, and that they're really anchoring on that physician alignment piece. But the data coming in is aggregating and being leveraged in other ways, such as the patient engagement component, and headed toward the enterprise HIE for the purpose of managing their business differently than it had been in the past, whether it be through some different risk arrangements or an ACO arrangement that is evolving in their community. So this is a foundational building block that Centra is leveraging and will be continuing to leverage over the course of time. So it's important to think through those steps, and I know Centra has spent a lot of time thinking through those strategic choices with us, and many of our customers are doing the same. So it's an important journey, and it's sometimes a difficult one, but I know Ben and Wendy have been tackling and addressing many of them as they come. So Sarah, are we going to open it up to questions?
Yeah, we're really eager to open up the session for questions at this point. So you all should have a Q&A chat box open in your window, as well as the chat box. So if you do have a question, please send that over through the QA box or the chat box, and we'll get that over to our speakers. So it looks like we did have one question come in, and this is for Wendy. Wendy, what did you feel like the biggest challenge, if you had to pick one thing around the orders and results and rolling that out? What was the biggest challenge, and how did you overcome that?
Well, I think the biggest hurdle that we had was actually just getting up the initial site, because there are so many moving parts to it. Like we talked about earlier, there's 6 or 7 different steps that have to take, and you have to tweak each one of those steps to make those work. But once you get those 7 steps set up, then your next site, you're just looking at steps 1 and 7 to tweak and get that working. So, the very first one took a great deal of patience and a lot of phone calls and a lot of working with, we had to work with our billing people and our NPI people, and it was a lot of work to get that initial site up. But once we got that process worked out, then we really have been able to make it repeatable and easier to roll out.
Great, thanks, Wendy. We had another question come in, and this one is actually for Ben. Can you speak to engaging the physician, and what motivates docs to really participate in these kinds of projects?
Sure. Well, whether it's an employed or non-employed physician, it's, what can you do to make my life easier and to help me get through my patient panel faster each day. And having this information readily available, connected straight into the disparate EHRs has done that. And it provided a measure, I think Wendy probably said it earlier, a measure of loyalty because you were able to do that. I will say that this is something our physician community expected us to have some time ago, and so their patience was rather thin at first. But clearly, if you don't engage the physicians in ways and show them that it's not going to be more work but actually less work, it won't be successful.
Great, thanks, Ben. I'm gonna pose this next one that came in to both of you. I know you mentioned, Ben, about your legal department and some discussions that you had with them. So the question that came in, I'll paraphrase a little bit, was this person's legal department's giving them a little bit of reluctance in terms of allowing them to develop this connectivity, concerned with some Stark components. So Ben, could you, I know we're not attorneys on this call, so I want to caveat that, but maybe give some insight in terms of the thought process of Centra, and I have some thoughts to share after that.
Right, I am not a lawyer, and I fight with them often, but so we were getting pushback initially from our legal team. The Stark exemption gets quoted to me quite regularly, and it's only to do with EHRs. And the way we finally settled on this has been, one, we've shared information via physician portals and things like that for 20 years here in Lynchburg. And we would drive X-ray images in cars years past, and we would certainly provide lab data results via one electronic form or another. And so ultimately that position prevailed, that Stark law allows you to do this, and we have been doing it via snail mail or SnickerNet or whatever you want to call it for years, and this is just an automated way of doing something we've been sharing with physicians for a long, long time.
Yeah, so Ben, that's consistent with what I hear from many of our customers around the country, is really looking at it from a replacement of a current process or a paper process. And when you encourage your attorneys, I've heard, and again, we're not attorneys on this call, to look at it in that view, there are times in which they start thinking about it slightly differently from a Stark perspective. It's really around that replacement of current processes that I think helps people get a little bit more comfortable with it.
Yeah, Steve, I would say if attorneys are like the ones I deal with, it's inevitably it's no to Stark, and you just spend a little time getting them to relax.
That's right. And so I had to follow up about the folks in New Jersey, but we'll share that one for another time. So, all right, well, Sarah.
Yeah. So big thanks to everyone, especially Centra, Ben, and Wendy. Thanks for joining us and sharing your story. Steve, thanks for taking the time to facilitate the conversation as well. So if you had a question that you weren't able to get answered today, feel free to shoot us a note at Relay Health or clinicalsolutions@relayhealth.com. And as a reminder, we'll be pushing out an email to all of you that recaps the event, as well as has a link to the recording of the event and a case study on Centra. So thanks again, and have a great afternoon.